I want to ask you a question, and I want you to answer it honestly, not for me, but for yourself. Before you left the house this morning, did you go to the bathroom even though you didn't really feel like you had to? Before you got in the car, before a long meeting, before going to bed, do you make those little just in case trips to the bathroom just to be safe? Just to empty out before something important? I need you to understand something right now. That habit, that one common, completely innocent feeling habit that most people don't even think twice about, could be quietly, systematically destroying your bladder. And I am not exaggerating. I have seen this single behavior turn normal, healthy bladders into dysfunctional ones over the course of just a few years. I have watched it strip people of their confidence, their independence, supplement, and their quality of life in ways that are devastating to witness. And the worst part? Almost nobody knows it's happening until the damage is already done. Stay with me, because what I am about to share with you today is something most doctors simply don't take the time to explain. And your bladder health, more than you realize, affects everything. My name is Dr. Mandell, and over the past 4 decades of clinical practice, bladder dysfunction has become one of the most quietly devastating quality of life issues I see in patients over the age of 50, and especially over 60. I say quietly because nobody talks about it. It's embarrassing. Patients come in and they'll tell me about their back pain, their blood pressure, their cholesterol, but the bladder problem? They whisper it. They apologize for bringing it up. I've had patients who suffered in silence for years before they finally told me what was happening. But here is what I want you to understand right from the start. Bladder dysfunction is not inevitable. It is not just a natural consequence of getting older that you simply have to accept. In a great many cases, the majority of cases I see, the bladder dysfunction was corroded by behavioral habits. Habits that seemed harmless, habits that seemed sensible, habits that nobody ever told them were wrong. And the single most damaging of all those habits, the one I see behind more cases of overactive bladder, urgency incontinence, and pelvic floor dysfunction than almost anything else, is the innocent, well-intentioned, completely misguided act of going to the bathroom just in case. Today I'm going to explain exactly why that habit is so destructive, what it does to the neurological relationship between your brain and your bladder, supplement, and then I'm going to walk you through several related bathroom habits that are doing serious harm to millions of people right now. This is important information. Let's get into it. Core problem: just in case, urination. Why? It's destroying your bladder. Let me explain to you how a healthy bladder is supposed to work, because understanding the normal is the only way to understand what goes wrong. Your bladder is a muscular sac. Its job is to store urine, collecting it gradually as your kidneys filter your blood and then release it at an appropriate time. A healthy adult bladder can comfortably hold somewhere between 12 to 18 ounces of urine, roughly the size of a large glass of water. Under normal circumstances, you should feel a first but gentle urge to urinate when your bladder is about half full. That is a polite, easily ignorable signal. Your brain registers it and files it away. The second, stronger urge comes when your bladder is around 2/3 to 3/4 full. That's when it becomes appropriate to actually find a bathroom. And a healthy bladder can wait beyond that point for a reasonable period of time without distress. That is the normal program. Supplement. and it is regulated by a highly sophisticated communication loop between your bladder wall, your spinal cord, and your brain. Now, here is what happens when you start going just in case. Every time you sit down to urinate at low volumes, when your bladder is only 20 or 30% full, you are teaching your brain something. You're training your nervous system to register that volume, that low, barely there level of fullness as the new signal to go. You are literally reprogramming the threshold. Do this consistently over months and years, and your bladder stops waiting to be full before it sends the alarm signal. It starts sending the alarm earlier and earlier. The capacity, the functional capacity, the volume your brain is trained to tolerate shrinks, not because of a structural problem, not because of a disease, because of a habit, because you told your bladder over and over again that a quarter full means full. This is how overactive bladder syndrome develops in otherwise healthy people. The bladder itself is often perfectly fine structurally. It's the neuromuscular programming that has been corrupted. Supplement, I had a patient, I'll call her Carol, a 64-year-old former teacher who came to me with what she described as a completely unpredictable, urgent need to urinate up to 15 times a day. She said she was afraid to leave the house without mapping out every bathroom along her route. She had stopped attending church. She had stopped going to her grandchildren's school events. She was, in her own words, a prisoner in her own home. When I asked her about her bathroom habits, what she described was a lifetime of precautionary behavior. She went every time before getting in the car, every time before a class when she was teaching, every time before bed, every time she passed a bathroom just in case. She thought she was being responsible. She thought she was preventing accidents. She had spent 30 years shrinking her functional bladder capacity to roughly a third of what it should be. So her brain and bladder were now having a dysfunctional conversation on an extremely compressed timeline, the most heartbreaking part. When I explained this to her, she started crying, not because the problem was so serious, but because she finally understood what had caused it. Nobody had ever told her. Not one physician in 30 years had ever connected her behavior to her symptoms. What people do wrong is they assume that going to the bathroom frequently is safe. Better out than in. Empty is better. These are the things patients tell me, and for the bladder, they are exactly wrong. What you should do instead, if you are someone who habitually makes just-in-case trips, is begin practicing something called bladder retraining. When you feel an early mild urge, practice waiting, not for hours, not to the point of real discomfort, but practice tolerating that first gentle urge for 5 to 10 minutes before you respond to it. Let your bladder practice holding. Let your nervous system practice ignoring the premature alarm. Over weeks, gradually extend the interval. Work toward urinating every 3 to 4 hours during the day, which is the physiologically normal range for a well-hydrated adult. It takes patience. It takes deliberate effort. Supplement. But I have seen this strategy consistently applied produce dramatic improvements in bladder function and quality of life without a single medication, without a single procedure. Related habit Thesis 1. Pushing and straining to urinate now. Once we're talking about bathroom habits, there are several closely related behaviors I want to address because they compound the damage and most people don't realize they're doing them. The first is something I see especially in men, but women are not exempt. And that is the habit of bearing down, straining, and pushing to start or speed up urination Many people have learned, sometimes from a young age, to actively use their abdominal muscles to push urine out. They tighten their belly, increase the internal pressure, and force the process along. It feels efficient. It feels like thoroughness. It is actually deeply counterproductive and potentially harmful. Here is why. Supplement. The process of urination is supposed to be driven by the bladder muscle, a specialized muscle called the detrusor, contracting naturally and smoothly as the sphincter at the base of the bladder relaxes. It is designed to work as a coordinated, pressure-controlled system. When you add abdominal straining to that equation, you are generating pressure in the pelvis that the system was not designed to handle repeatedly. Over time, particularly in women, this contributes to the weakening and descent of pelvic floor structures. It is a known contributing factor to pelvic organ prolapse, the downward displacement of the bladder, uterus, or rectum into the vaginal canal. Supplement. This is a condition that affects an estimated 1 in 3 women who have given birth, and habitual straining during urination significantly accelerates its progression. Supplement. I had a patient, I'll call her Norma, a 70-year-old woman, who came to me with a feeling of pressure and heaviness in her pelvis. She described the sensation of something falling down there. On examination, she had a moderate cystocele, a prolapse of the bladder into the front wall of the vagina. When I asked about her bathroom habits, she told me she had always been a pusher. She thought she was being thorough. She was, in reality, generating chronic downward stress on her pelvic floor every single day, multiple times a day, for decades. What you should do instead: sit down, never hover, relax completely, breathe gently, and allow your body to do the work. You do not need to push. If urine does not flow easily and the urge was real, your bladder will take over. Forcing and rushing disrupts the system. Relaxing and allowing is the correct approach. Related habit TT2. Hovering over the toilet seat high. No, this one might make some people shift in their seats. But I have to address it because it is far more common than people admit, and the consequences are real. Hovering. Squatting partially above the toilet seat rather than sitting fully down. Millions of women do this, particularly in public restrooms, out of genuine hygiene concerns. And I understand the instinct completely. But from a pelvic floor and bladder health standpoint, hovering is one of the most problematic habits a woman can have in the bathroom. Here is the problem. When you hover, your pelvic floor muscles, the complex hammock of muscle that supports your bladder, uterus, and rectum from below, cannot relax. You stay partially contracted because your body is in a squat position requiring muscular stabilization. And when the pelvic floor cannot fully relax, the bladder cannot fully empty. You leave the bathroom thinking you've finished the job, but 10 to 15% or more of your urine may still be sitting in your bladder. Residual urine that sits stagnant in the bladder, is a breeding ground for bacterial growth. This is one of the reasons why women who frequently hover have significantly higher rates of recurrent urinary tract infections than those who sit fully. But there is a longer-term problem as well. If you consistently try to empty your bladder against a partially contracted pelvic floor, you begin to train a pattern called dysynergia, a discoordination between the bladder's urge to contract and the pelvic floor's failure to fully relax. It sets the stage for chronic incomplete emptying, urinary urgency, and over time, genuine bladder dysfunction. I had a patient, I'll call her Sandra, a 58-year-old executive who traveled constantly for work and used public restrooms multiple times a day. She came to me with a pattern of recurrent UTIs, 3 or 4 a year, and persistent urinary urgency. When I asked if she sat or hovered, she said she never sat on a public toilet. Ever. She hadn't in 20 years. The intervention was straightforward. I explained the physiology, recommended she always place a barrier on the seat if hygiene was the concern, sit fully, relax completely, and allow complete emptying. The UTI frequency dropped dramatically within 6 months. Related habit Tish 3. Drinking too little water out of fear of having to go this one breaks my heart every time I see it. And I see it constantly, particularly in older adults. The logic goes like this. The more I drink, the more I have to go. And if I have to go too often or I'm afraid of not making it in time, then the obvious solution is to drink less. So patients start cutting back on fluids, stop drinking water with dinner. They avoid anything to drink after noon. They sip carefully and sparingly throughout the day, always calculating, always afraid. If you are over 60, this is critical. What I am about to tell you is one of the most important things you will hear today. Dehydration makes overactive bladder worse, not better, worse. When you are dehydrated, your urine becomes highly concentrated. Concentrated urine, loaded with waste products, mineral salts, and metabolic byproducts, is profoundly irritating to the lining of the bladder. It acts as a chemical irritant, inflaming the bladder wall and triggering hypersensitivity in the very nerve endings that detect fullness and generate urgency signals. So your small, partially filled bladder is now filled with irritating concentrated urine, and it is screaming at you in urgency signals that have nothing to do with how full it actually is. The more you restrict fluids, the more concentrated your urine becomes, the more irritated your bladder lining becomes, and paradoxically, the more frequently and urgently you need to go. It is a vicious cycle, and it is one I have seen trap patients for years. Supplement. I had a patient, I'll call him Bernard, a 72-year-old retired accountant who had drastically reduced his fluid intake after several embarrassing near accidents at the grocery store. By the time he came to see me, he was drinking barely 4 glasses of water a day. His urine was dark amber, a clear sign of dehydration. He was experiencing urgency 15 or more times a day. He was miserable and frightened. I put him on a structured hydration protocol, 6 to 8 glasses of water spread evenly throughout the day, with reduced intake in the 2 hours before bedtime. Supplement. Within 3 weeks, his urgency frequency had dropped by nearly half. He was stunned. He had been certain that more water meant more problems. His bladder had been telling him the opposite. What you should do: drink consistently and steadily throughout the day. 6 to 8 glasses of plain water distributed evenly is the target for most adults. Reduce intake in the 2 hours before bed to minimize nighttime disruption, but do not restrict fluid intake during the day. Your bladder needs well-diluted, low-irritant urine to function calmly. Related habits 4. Ignoring urges for hours on end now. I have been telling you to stop running to the bathroom at every mild urge, and that is correct. But I want to address the opposite extreme as well. because I've seen this mistake cause serious harm too. There are people, often those in demanding jobs, so caretakers who put everyone else first, who routinely ignore their bladder's signals for 4, 5, 6 hours at a stretch. They hold in ways and for periods of time that put enormous chronic pressure on the bladder wall. They tell themselves they're too busy. They tell themselves they'll go at the next break. It's chronically overfilling the bladder, stretching it consistently beyond its comfortable capacity. Damages the detrusor muscle over time. The bladder wall can lose its ability to contract effectively. What develops is something called an underactive or hypotonic bladder, one that can hold enormous volumes but can't empty properly. Incomplete emptying becomes the norm. The risk of UTIs rises dramatically because stagnant urine breeds bacteria. A patient I'll call Thomas, a 69-year-old surgeon who had spent decades powering through long operating cases without bathroom breaks, came to me unable to fully empty his bladder and experiencing significant urinary hesitancy. Supplement, the imaging showed a significantly enlarged bladder with poor contractile function. Years of overstretching had compromised the muscle. A healthy target is urinating every 3 to 4 hours during waking hours, not every 30 minutes, not every 6 hours, every 3 to 4 hours, responding to a moderate, real urge at a 2/3 full bladder. That is the window where your bladder performs optimally and stays healthy long term. I want to be honest with you about something. Of all the conditions I treat, all the chronic diseases, all the complex diagnoses, bladder dysfunction is the one that I think causes the most quiet, invisible suffering. Not because it's medically the most dangerous, but because of what it takes from people. I have had patients who stopped traveling, who stopped going to concerts, to theaters, to sporting events, who stopped accepting dinner invitations because they couldn't guarantee a bathroom would be available, who stopped sleeping through the night, who stopped sleeping well, full stop, because the bladder was running the show. I have watched confident, independent, supplement vibrant men and women allow a malfunctioning bladder to shrink their world down to the size of a room with a toilet in it. And the tragedy, the real tragedy, is that in so many of those cases, the problem was behavioral. It was built over years by habits nobody ever questioned, and it could have been prevented. In many cases, even now, it can be meaningfully reversed. You deserve to live fully. You deserve to travel, to attend the events that matter, to sleep through the night, to leave your home without anxiety. Your bladder should serve your life, not run it. Please do not accept dysfunction as destiny. There is almost always something that can be done. Let me bring this all together for you. The number one habit destroying your bladder is going just in case. Urinating before you feel a genuine moderate urge. Supplement, which progressively shrinks your functional bladder capacity and rewires your urgency signals. The solution is bladder retraining, practicing tolerating mild urges and working toward urinating every 3 to 4 hours. The related habits to stop immediately: straining and pushing to urinate, which damages your pelvic floor; hovering over the toilet seat, which prevents full relaxation and complete emptying; restricting your fluid intake out of fear, which concentrates your urine and increases irritation and urgency; and chronically ignoring your bladder for hours on end, which overstretches and weakens the bladder muscle. None of these habits are your fault. Nobody told you, but now you know, and now you can change. If this video opened your eyes, if you recognized yourself in any of these habits, please do these 3 things right now. Hit the like button. It costs you nothing, and it tells me this kind of honest, practical medical information is reaching the people who need it most. Subscribe to Longevity Lane and ring that notification bell. Every week I am here with the real health information that most people only find out about when the damage is already done. You deserve to stay ahead of that. And please leave a comment. Tell me, did the just in case habit surprise you? Have you been restricting fluids? Have you had bladder issues you've been too embarrassed to mention? You are not alone. The community is a safe space. I read every single comment, and your words genuinely matter. Share this video with someone in your life, a sister, a mother, a husband, a friend who has been struggling quietly with bladder symptoms and doesn't know why. This information might change everything for them. Your health depends on this information. Please don't keep it to yourself. The habits that quietly destroy us are almost never the dramatic ones. They're the small ones. The ones that feel responsible. The ones that feel like common sense. The ones nobody questions because everybody does them. Going just in case feels responsible. It feels cautious. For decades, it felt like the right thing to do. But your bladder has been paying the price of that well-intentioned mistake in silence, and now, I hope, in understanding. Knowledge is only powerful when you act on it. So starting today, this afternoon, pay attention to your bathroom habits, not with anxiety, not with obsession, but with the calm, informed awareness of someone who now understands the system they're working with. Because your bladder is not your enemy. It is one of the most faithful, hard-working organs you have. It has been doing its job under difficult conditions for your entire life. The least you can do, the very least, is stop making that job harder. This is Dr. Mandell. Take care of yourselves. Smallest habits, changed consistently, can give you back a freedom you may have forgotten you were missing. I'll see you in the next video. If you care about your health, want to understand what's silently harming your body, and are ready to learn the truth about living a longer, stronger, and healthier life, subscribe to Longevity Lane with Dr. Mandell. Here, we reveal the health truths most people discover only when it's already too late.